All right, so let's kick off with the big one, chronic low back pain. I mean, who hasn't had that annoying ache in their back at some point? It's like the weather. Everyone's got a story, right?
Absolutely, Mia. It's one of those things that can sneak up on you and suddenly you're planning your whole day around whether you can tie your shoes or not. And when we say chronic, we're talking about pain that sticks around for more than 3 months, not just a one-off twinge after moving a couch.
Yeah. And it's not just the pain, is it? It messes with your mood, your sleep, even your confidence. I've seen people who just stop doing the things they love because they're worried about making it worse. It's a real thief, honestly.
Spot on. And that's why researchers look at more than just pain scores. They measure disability, how much the pain limits your daily life, and flexibility too. Like, can you actually bend over and pick up your socks? These things matter in real life, not just on a chart.
Totally. And I always get the muscle names mixed up, but it's not just about the back muscles, right? It's your core, your glutes, all working together. If one bit's off, the whole system feels it.
Exactly. Actually, I had a patient, let's call him Dave, who came in convinced he'd just have to live with it. But once he got into a structured exercise program with a bit of guidance, he started to see real changes. Not just less pain, but more confidence. He was back out walking his dog, even started gardening again. Sometimes it's about finding the right combo, not just one magic fix.
Love that. And it's a good reminder that chronic low back pain is complicated. It's not just about fixing a sore spot, it's about getting your life back. So, let's get into the study that's got everyone talking. Angus, can you give us the basics? Who was in it? What did they do?
Sure thing. So, this was a prospective study, meaning they followed people forward in time, done at a single medical centre. They had 54 people, all aged between 25 and 65, all with chronic low back pain for more than 3 months. And they made sure everyone had some wear and tear showing up on their x-rays, so it wasn't just random aches.
And they split them into 2 groups, right? One got high-intensity laser therapy, HILT for short, plus exercise. The other got ultrasound therapy plus the same exercise program. No extra meds, no sneaky treatments on the side.
Exactly. And the exercise bit is important. It was all about isometric and static moves, so strengthening the back, abs, glutes, but without a heap of movement. Think gentle core tightening, some leg lifts, stretching the back of your legs. They started with a physio, then kept it up at home for 3 months.
And they were strict. No one with nerve problems, no back surgeries, nothing that could muddy the waters. They really wanted to see what these 2 therapies could do for chronic low back pain, pure and simple.
Right. And to measure progress, they used 3 main tools. The pain rating scale, just a 0 to 10. How bad's your pain? The Oswestry Disability Index, which is all about how much pain messes with your daily life. And Schober's test, which checks how far you can bend forward. They measured at the start, after 2 weeks of treatment, and then again 3 months later.
So what did they find? Drum roll, please.
The laser group came out on top. At both 2 weeks and 3 months, they had a much bigger drop in pain scores. At 2 weeks, their average pain was about 2.1 out of 10, compared to 4.26 in the ultrasound group. And at 3 months, it was 1.89 versus 4.89. That's a pretty chunky difference.
That's huge. And what about disability? Were they actually able to do more?
Yep, same story. The laser group's disability scores dropped more, down to about 16.3 at 2 weeks, compared to nearly 26.7 for ultrasound. And that held up at 3 months too. So, less pain, less limitation.
And flexibility? Did they get bendier?
Not straight away. After 2 weeks, no big difference. But by 3 months, the laser group had a statistically significant edge. About 6.5 centimeters improvement in forward bend, compared to 6.1 centimeters for ultrasound. Not massive, but it's there.
So laser plus exercise wins on pain, disability, and eventually movement. But why? Why might laser therapy work better than ultrasound?
Good question. The study suggests HILT might reduce inflammation, boost blood flow, maybe even help nerves regenerate. It could also ramp up your body's natural painkillers, endorphins, and block some of the chemicals that trigger pain. Ultrasound, on the other hand, is more like a micro-massage, vibrating tissues, creating a bit of heat, helping with pain and flexibility, but maybe not as many effects at once.
But And it's a big but, this was a small study, just 54 people. And it's hard to know if everyone did their home exercises perfectly. Plus, they didn't look at things like people's jobs or body size, which could matter.
Exactly. So, while the results are promising, we've got to be careful not to overhype it. More research, bigger groups, longer follow-up. That's what we need to really know how well this works for everyone.
All right, so what does all this mean if you're listening and thinking, should I try laser therapy for my back? First, both treatments were safe. No nasty side effects in either group. That's a relief, right?
Absolutely. But before you jump in, it's worth asking your provider a few things. Are they trained in HILT? What's their experience? And how will exercise fit into your plan? Because honestly, the exercise was a huge part of the results for both groups.
Yeah, and I'll be honest, this whole process reminds me of when I first started working in health. I had a serious case of imposter syndrome, like, am I doing this right? Is this even working? And sometimes finding the right treatment for pain is a bit like that. You try, you tweak, you learn as you go. It's not always a straight line.
That's such a good point. And just like you kept showing up and learning, managing chronic pain is often about sticking with it, trying different things, and not giving up if the first approach doesn't work.
So if you're curious about high-intensity laser therapy, also called photobiomodulation, maybe have a chat with your physio or chiro. And if you want to know more, the team at Spine Sport Feet Clinic in Helensvale have been using HILT for soft tissue injuries for a while now. You can check them out at www.spinesportfeet.com.au.
And remember, this is just one study. Science is always evolving, and what works for one person might not be the answer for everyone. But it's exciting to see new options being explored, and we'll keep following the research as it comes out.
All right, that's a wrap for today. Thanks for tuning into the Spine Sport Feet podcast. Angus, always a pleasure to nerd out with you.
Likewise, Mia. And thanks to everyone listening. Keep those questions coming, and we'll catch you next time with more science, stories, and maybe a few more of Mia's off-key singing moments.
Oi, I'll work on my scales. Promise? See you next time, everyone.